Hello, my name is Teresa Lee, and this is my neuro exam for MSN 572. Today is June 8th, 2024, and I'm going to start with a 360 room scan. Got the ceiling and the floor. Okay, so we're going to go ahead and start. So before we get started, I just need your consent to do the assessment as well as posting it on YouTube for my instructor grade.
Mm-hmm. Yeah, my consent.
Perfect. All right, so with the neuro exam, I'm going to test for level of consciousness first, and patient is alert, awake, and responsive. Can you tell me what your name is?
Tom McCall.
Perfect. What day is it today?
June 8th, 2024.
Yep. And then why are you here today?
For a wellness checkup.
Perfect. And then do you know where you're at right now?
Yes.
Where are you?
I'm at your clinic.
Perfect. So patient is alert and oriented ×4 to person, place, time, and purpose. Next, I'm going to ask you to repeat this sentence for me. And this sentence is, the brown fox jumps over the box.
The brown fox jumped over the box.
Perfect. And speech is clear, fluent, and articulate. I'm going to ask you to remember 3 words, and the words are apple, cat, and bottle. Okay, go ahead and repeat that.
Apple, cat, bottle.
Perfect. So try to remember that. I'm going to ask you again in a few minutes. Okay. And then what did you have for breakfast yesterday?
Pancakes.
Perfect. And then if you found a stamped envelope on the ground on the street, what would you do with it?
I'll definitely return it at USPS and get it shipped there.
Perfect. So patient's judgment and reasoning is appropriate. His remote memory, I'm going to go back, his remote memory was also good. And then do you remember those 3 words that I used?
Apple, cat, bottle.
Perfect. And then recent memory is also good and intact. Okay, so we're going to move on to the different cranial nerves. So beginning with cranial nerve 1 is the olfactory. I'm going to test your sense of smell. So I'm going to have you close your eyes. You're going to plug one nose and then let me know what you smell. It's either lavender or vanilla.
Lavender.
Perfect. And then go ahead and do the other nose.
Vanilla.
Perfect. All right, so cranial nerve 1 olfactory is intact. He did know which scent was which. Next is cranial nerve 2, which is the optic nerve. So I'm going to test his visual acuity, and that will be at 6 feet apart. Usually in clinic will be either on the wall at 20 feet apart, but for this one, you're going to cover one eye with your palm, and then let me know what the lowest line is that you can read.
LTFPH, which is the lowest one.
Yep, and then go ahead and switch eyes. And the lowest.
LTFPH.
Perfect, and then with both eyes.
LTFPH.
Perfect, and that is, are you wearing contacts? No? Okay,
Yeah,
that's on corrected vision. Okay, next I'm going to test your peripheral vision. So I'm going to have you cover one eye, and then you're going to let me know when you see my wiggling fingers.
I want to see it.
Perfect.
Let me see it.
Okay, and then cover the other eye.
Let me see it.
Perfect.
Right here.
All right, so peripheral vision is intact. Next, I'm going to look at your pupils. So I've got my pen light here. You're just going to look straight ahead. And this is testing cranial nerve 3, which is oculomotor. do see that his pupil is constricted with direct light, and then I'm going to test it again and look at the opposite eye. And patients' pupils constrict, they're equal, rounded, reactive, consensually to light also. Next, you're going to look at my pen light and then look at something in the distance. Back at my pen light. Perfect. And his pupils are reactive to accommodation also. Okay. Next, I'm going to do my fundoscopic exam. So I'm going to look inside, which I should have done for actually optic nerve 2. Okay, so you're just going to look off in the distance. And I'm going to look at your eye. Coming in carefully, my right eye to his right eye. I am going to be looking for the red reflex, which should be a reddish-orange color. And then once I see the red reflex, I'm going to come in to see his retina in the back, as well as the optic disc. Okay. Perfect. And I did see the red reflex, and then coming in with the optic disc, that was a orangish yellow color with central physiologic. It had sharp margins. I did see the optic that the optic disc to cup ratio was 3:1. And then I did see the veins that were larger and darker and more reflective to light, and then the arteries were lighter, brighter, and smaller. I was able to visualize the macula, which is lateral to the optic disc. It is responsible for central vision and contains rods and cones. And then the fovea was with a depression within the macula, and it contains cones. Okay, and then I would repeat it for the other side. So his left eye to my left eye, and then I should be able to find the same findings. Okay, so moving on to, so going back to cranial nerve 3, which is ocular motor. I had already tested his pupils, so now we are going to test his extraocular motor. Oculomotor for cranial nerve 3 is going to be, or you're going to follow my pen light, is up and diagonal, diagonal, and down, diagonal, diagonal, and up. Perfect. So cranial nerve 3 is the ocular motor. Movements are intact. Next, we're going to test the trochlear, which is going to be motors of medially and downwards. So you're going to follow. Perfect. So the trochlear nerve is intact there. And next is the facial nerve, is the trigeminal nerve, which is cranial nerve 5. So I'm going, and there's 2 parts, is motor and sensory. So go ahead and open your jaw against my resistance. Perfect, and that's 5 out of 5 strength, so that is intact. And now I'm going to just poke at your face with some different objects. You're just going to let me know if it's dull or sharp, and then go ahead and close your eyes.
Dull. 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 No.
Okay, this was supposed to be sharp.
Okay, sorry.
Okay, so if it's not the cotton pad, then it's supposed to be sharp. I just don't want to actually poke you with it.
Okay.
Okay, so we're going to try again.
Dull. Sharp. Dull. Sharp. Dull. Sharp.
Perfect. So go ahead and open your eyes. So he was able to guess right. His ophthalmic, maxillary, and mandibular branches are all intact for trigeminal nerve. Next is the abducens, and that is cranial nerve 6. So that's checking for lateral movement of the eye. So again, you're just going to follow my pen light. Perfect, and he is able to perform that. So the abducens nerve is intact. Next is the facial nerve, which is cranial nerve 7, and that is going to test for movement. So go ahead and raise your eyebrows for me, Perfect, and he's able to do that, and it is symmetrical bilaterally. And then go ahead and smile real big, and then puff out your cheeks. Perfect. So both of those are intact. It is symmetrical bilaterally, and he was able to perform. Next is cranial nerve 8, which is acoustic. So I'm going to stand behind you about 2 feet, and then I'm just going to whisper 3 words to you. You're going to cover the ear that where I'm kind of whispering into, okay? And then you're just going to repeat.
Can you go one more time? Sofa 6.
Perfect. And then I would do it on the other side.
432.
Perfect. All right, so he was able to repeat that. Next, I'm going to do the Weber test. So I'm going to use my tuning fork here, and I'll place them on the top of your head. You're going to let me know if you hear it in both ears or just one.
Oh.
Perfect. So that is a positive finding. So he does have conduction in both ears, and that is a normal finding. Next, we're going to do the Rhine test. So it's going to be, I'm going to place it behind your mastoid bone on each side. You let me know when you do hear it, when you don't hear it anymore, and then if you hear it again.
Here. Here.
Let me know when you don't hear it.
Yeah. Here.
Okay.
Yeah.
Perfect. So he was able to hear it when I moved, or he heard it, and then he didn't hear it anymore, and then he was able to hear it when I moved it forward, which means that air conduction is longer than bone conduction, and that is a normal finding. Okay. Next is cranial nerves 9 and 10, which are the glossopharyngeal and the vagus nerve. So go ahead and open your mouth. Say, oh, stick out your tongue, say ah. Perfect. I do see that his uvula raises midline, and it was symmetrical when he did say ah. Go ahead and stick out your tongue again for me. Perfect. And then at this point, go ahead and swallow for me. Perfect. So swallowing is intact. In clinic, I would perform a gag reflex, just placing a tongue depressor on the back of his throat or the back of his tongue to see if he has a gag reflex. If he does, then both cranial nerves 9 and 10 are intact. And again, those were the glossopharyngeal and the vagus nerves. Next, we're going to test your cranial nerve 11, which is spinal accessory. So go ahead and shrug your shoulders against my resistance. Perfect, 5 out of 5. And then I'm going to have you turn your head against my resistance. Perfect, and this side. Perfect. So again, 5 out of 5 straight, and they were symmetrical bilaterally. So that cranial nerve 11 is intact. Next is cranial nerve 12, which is the hypoglossal nerve. Go ahead and stick out your tongue for me. Move it left, right, perfect. And then go ahead and press it against your cheek. Perfect, and other side. Beautiful. So patient's tongue was midline and symmetric. I did not see any deviations. He was able to move his tongue both sides, or both ways. And then 5 out of 5 strength for pressing it against his cheeks. Okay, next is the cerebellum. So I'm actually gonna have you get up, and then I'm just gonna watch you walk. So from that end, you're just gonna walk normally towards me, and that's just your general gait. Perfect. So patient is able to perform correctly. I don't see any drifts. He's got good balance and gait, and it's even. And now you're gonna walk heel to toe in a straight line. Perfect, and patient is able to perform, again, steady gaits, and he's able to follow directions. Next, I'm gonna have you walk on your heels towards me. Perfect, and then go back opposite, you're gonna walk on your toes. Perfect, so both gaits, patient is able to perform correctly, steadily, and without swaying. Okay. So you're gonna stand here and we're gonna do the Romberg test. So I'm gonna have you place your feet together and then go ahead and close your eyes. Perfect. Patient did not have a drift, which is a normal finding. So go ahead and open your eyes, and now I'm gonna have you place your arms up like this and then go ahead and close your eyes. Perfect, and patient does not have a pronator drift, which is when his hands start to drift forward or start to flip and then go downwards. So negative finding there, so that is good. All right, so go ahead and hop back up. Next, I'm going to have you close your eyes. I'm just gonna give you your hand here. I'm gonna test your joint position, so let me know if you feel your finger moving up or down.
Up,
Perfect.
down, down, up.
Perfect. And you did get that correctly, so that is positive, which is good. Next, we're going to test his pain sensory and tactile sensory. So I'm going to have you close your eyes. So again, there's the cotton and then the pin is the sharp. So closing his eyes, I'm going to do 3 on each extremity. So I'm going to hold this up.
Cotton.
So dole, yeah.
Dole. Sharp. Sharp. Dole. Sharp.
Perfect. And those were all correct for the upper extremities, and now for lower, you're going to be able to feel the sharp.
Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull.
Perfect. And you did get those correct, so his sensories are intact, and they were correct bilaterally. Next, I'm going to test for vibration sense. So I'm going to tap this again, and then you're going to let me know if you feel the vibration on your ankles. And I'm just going to tap.
Yeah.
Perfect. So vibration sense is positive, and that is a normal finding. Okay. Next, I'm going to test your muscular movements. So we already did the shoulder shrug. So you're just gonna keep your arms out like this, and then go ahead and press up against my resistance. Perfect. So deltoids, and then put your arms up like this, and then pull up against me, and push against me. Perfect. And then for hands, you're gonna push against my hands. Perfect. And then push the opposite way, or pull the opposite. Perfect. So deltoids, biceps, triceps, and wrists were all 5 out of 5 strength, and they were equal bilaterally. And now for your fingers, you're going to try to pull your fingers apart. Perfect. And then try to push them together. Beautiful. And same for fingers, 5 out of 5 strength, and then go ahead and squeeze my fingers. Perfect. And 5 out of 5 hand grip. Next, we're going to do the same for your thigh, for your legs. That side can't go up. I'm going to have you sit just on the edge here. Okay, so just with one at a time, you're going to lift your leg. Perfect. And the side. Beautiful. And then try to pull down. Perfect. And pull down. And then same here. Perfect. And then you're going to rotate your leg out this way. Beautiful. And then against. Same and same. Perfect. And then feet. Push up. And then down. Awesome. Okay, so with quadriceps and hamstrings, he had 5 out of 5 strength, along with the lower legs, and his feet were also 5 out of 5 strength against my resistance. Okay, so while you're sitting, we're gonna do your deep tendon reflexes. So whenever I hit your reflex, you're just gonna jerk your arm up. So we're gonna test his the bicep reflexor first. Perfect. And now for the tricep. Beautiful. Then we're gonna do the same on this side. I'm gonna test your bicep first. Perfect. And then beautiful. So they were symmetrical on both sides, and that is an equal or a normal finding, and they were 2+. Next, I'm going to test your patellar. Beautiful. Perfect, and that is also 2+. And then we're going to test your Achilles tendon or reflex. Perfect. And then that was also 2+. And then lastly, I'm going to have you lay back, and we're going to do your Babinski. So you're going to press forward. So using this, or the sharp end of my tool here, I'm just going to go ahead and relax. And then perfect. And beautiful. So his toes do flex forward, his feet flex forward, and that is a normal finding, which is a negative Babinski. I'm just gonna think if I forgot anything else. Okay, I believe that was everything. That concludes our assessment. Thank you so much.